morning, class. My name is Kate Martin. I would love to talk to you today about malabsorption syndrome. Malabsorption syndrome is a disorder interfering with the body's ability to digest food and nutrients, leading to various nutritional deficiencies and associated long-term symptoms. So some general clinical manifestations of malabsorption include frequently weight loss, obviously, bulky, foul-smelling stools are very frequently seen, chronic diarrhea, anemia. There is a lack of fat-soluble vitamins such as A, D, E, and K. Frequently, this leads to lots of bone density issues such as osteopenia and osteoporosis down the line. You see a decrease in the efficacy of a person's immune system, and there is frequently an increase in risk of cardiovascular events such as heart attack and stroke. So malabsorption syndrome, you can classify all of the different associated disorders into two different categories. The first being digestion issues, and the second being absorption issues. So in digestion issues, there are several different causes. You can see a mechanical issue with the stomach as far as structure or function, where the food is not appropriately mixed and churned with the digestive enzymes with the stomach acid. It's not appropriately mixed, and therefore it's unable to be fully digested as it goes through the GI tract. Another digestion issue can be from an excess of stomach acid, an excess of good bacteria, and an excess of stomach acid and an excess of good bacteria, as well as a deficiency of stomach acid, a deficiency of digestive enzymes that will also lead to multitude of different disorders or different issues. A great example of a digestion issue, the one that I feel like the common public knows, is that of lactose intolerance. This happens when the small intestine doesn't have enough of the enzyme lactase, or it is completely deficient of lactase. Lactase is responsible for breaking down lactose, and lactose is a sugar that's found in dairy and milk products. So anybody that doesn't have enough or has any of this enzyme is going to have a really bad day when they eat ice cream or cheese or milk, leading to abdominal pain, watery diarrhea, bloating, lots of abdominal pain. And this is something that is the prevalence was astounding. I was really surprised to see in my reading that it affects every single ethnic group in very high percentages across the board. So when we talk about absorption issues, when we're talking about malabsorption syndrome, some different absorption issues can also be any of those are going to affect the body's ability. It can digest the food, but then it can't. Absorption issues, you would be unable to extract all of the nutrients that you possibly can out of the food that you're feeding your body. So again, we can have a mechanical issue, such as in short bowel syndrome. So in this regard, there's a structural issue where either due to a congenital abnormality, or perhaps you suffered a trauma or a GI bleed, or something happened to you in your life where you had to have your bowel shortened, like surgically shortened, or you were just born with a shorter bowel due to a congenital abnormality. So short bowel syndrome, that's exactly what it is. Your bowel is shorter than it should be, and therefore you don't have all of the time that you need to extract all of the nutrients. You can also have an absorption issue that stems from a some damage to the lining of the bowels. Frequently, we can see a gastroenteritis is a really great example of this. Although most gastroenteritis bouts are short, it is still an example because a bacteria, a virus, a parasite can cause damage to the lining of the small intestine, and it renders the body unable to properly extract all the nutrients that it needs to. Another absorption issue that kind of works the same way, we see in both Crohn's disease and celiac disease. So Crohn's, they're similar but different. Crohn's disease is an inappropriate immune response, and this can happen anywhere in the GI tract, but it leads to a transmural inflammation of an area or multiple areas in the GI tract. Transmural being all parts of all thicknesses of the wall of the intestine, and long-term transmural inflammation is going to lead to lots of issues with absorption, inability to extract all the nutrients that you need. Celiac disease is similar in the sense that there are lots of absorption issues, and it is also an autoimmune disorder. However, this is an autoimmune disorder that stems from the ingestion of gluten and specifically attacks the villi of the small intestine. They become atrophied and are unable to extract the nutrients. Anybody who knows anybody who is gluten-free at this point knows how difficult it is. It's not just a matter of avoiding bread, it's in seasoning, it's in malt beverages, it's flavorings and sodas. If you buy prepackaged shredded cheese, there's flour in between the cheese to keep it from sticking. So again, a really bad day. This is a really ugly long-term chronic disease, and it's still unfortunately really hard to avoid gluten at this point. So Crohn's and celiac are other great examples of how damage to the lining of the small intestine can cause a malabsorption, lots of malabsorption issues and their associated symptoms. There are a few unrelated GI diseases that I'd love to go over. I think it goes without saying that most GI disorders or diseases can cause some type of malabsorption, whether it's short-term or long-term. You can see malabsorption as an effect of most GI disorders. However, they are not considered under the umbrella of malabsorption syndrome, like the diseases that I explained before. So irritable bowel syndrome, this is a GI disease that's considered a functional disorder. It is a cluster of symptoms such as abdominal pain, bloating, and just alternating changes in bowel habits. You can see chronic constipation, you can see chronic diarrhea, or you can see an alternation of both. They call this a functional disorder because there's no alteration in structure that they are able to see as they're working this person up. Everything looks normal on blood tests, in biopsies, in endoscopies. However, all of these symptoms just sort of happen and they're not really easily explained away. So that's irritable bowel syndrome. And obviously, if you have chronic constipation, chronic diarrhea, anything that's pretty regularly affecting your digestion and bowel habits, you can have an associated malabsorption with that, right? Gallstones are a collection of, it's usually cholesterol, hardened cholesterol deposits located inside the gallbladder. A lot of people just live with these and have no symptoms and don't even know that they're there. But frequently, if there are symptoms, then the gallstones are actually blocking the flow of bile into the intestines. And that can also in addition to abdominal pain, bloating, fatty steatorrhea, fatty diarrhea. It can also lead to malabsorption, anything, because it's something that affects your digestion, right? And a third unrelated GI disorder is Hirschsprung's disease. This is commonly found in teeny tiny newborns or brand new babies. It is a lack of nerve cells in the muscles of the digestive system. And those muscles are responsible for peristalsis. So if you have something impeding peristalsis in your GI system, then you're going to have chronic constipation, right? So these babies will have abdominal pain, bloating, inability to pass stool, which will inadvertently will obviously lead to poor feeding, poor intake, and poor nutrition, because they are obviously in pain every time they try to pass things through their GI system. So this, of course, will, anything that leads to poor feeding is going to lead to malabsorption, malnutrition, and the long-term consequences. So thank you so much for sitting through my malabsorption syndrome spiel. I hope you guys have a great rest of the day.